Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County branch of the American Association of University Women, one of the civic partners for this show. Today we have Andrea Montgomery in the studio with us. Andrea is the director of the St. Lawrence County Office of the Aging, and we're going to be talking about aging in place today. Andrea, thank you for coming back in. It's always great to have you.
I appreciate you having me.
Well, you have been a great guest over the years and talked a lot about what your office can do for seniors in the county. And let's just remind folks that according to current census figures, 15.3% of our county population is 65 or older, which is slightly higher than the state average. And if we add in folks who are in the 60 to 64-year-old range, we have an additional 4.3. So basically, your office focuses on about 20% of the county population, doesn't it?
Absolutely.
And there are some rural counties in New York State where that number is actually higher. So
Sure.
For a lot of rural New York State, figuring out how to take care of the senior population and assist them is a big part of county work, isn't it?
Absolutely. Every single day it's the discussion that's had of how can we better serve our residents.
Right. So let's talk, in fact, one of the things that we've seen in some of the literature about this is that the number of seniors is going to increase because the boomers are all starting to retire now. And it's been called a retirement storm, hasn't it? It's because of the numbers and the fact that for a lot of planning still needs to be done about how to handle this, doesn't it? And it hasn't been done.
Very much so.
So let's talk for a minute about the scope of the problem. What are you seeing in terms of the numbers of seniors and the kinds of needs that they have, and what kind of planning has your office been able to do for this retirement increase that is coming?
The biggest thing that we've done thus far is advocacy, because we are nowhere near prepared for this boom. And I mean on the local, state, and federal level. One of the things that's been really frustrating for us is that the funding levels have remained stagnant. So, we haven't received increases in 5-10 years in some programs, and now we're looking at doubling our population of seniors in the country in just 13 years, which is not very long when you think about it. It's coming quick. So we've been doing a lot of advocacy, as well as we've increased our staffing levels, more trained, qualified staff to know, the different senior aging issues that are going to come up. The big thing that's going to come up, though, is the lack of services in our county. And that's going to be a challenge.
One of the most recent guests I had on the show is Blue Carricker, and she was here talking about the needs of the childcare needs that are coming up. And she said one of the things that happened this year during the budget negotiation was that quite a bit of money was cut from the existing childcare at the state. And basically the legislators came to the advocates and said, well, you have a choice. We'll take it from you or we'll take it from seniors. And the two most vulnerable part of our population in this state, and that's where they were going to find the cuts from. So you can't win.
There's no good choice there.
There isn't a good choice now. So one of the things that, in fact, I just saw a piece on the news yesterday, and it was talking about the Department of Labor at the federal level was talking about where the jobs are going to come from. And they basically said, well, it's all well and good to train for STEM jobs, but what we're really going to need are home health care aides, because that's where there's going to be a huge jump in need. So let's talk a little bit about that and the need for home health care helpers, the kinds of work that will actually need to be done to take care of this boom.
Yeah, well, already in our county we have a shortage of home health aid workers. We were talking earlier about how people call the Office for the Aging and they can, get people in right away to give them referrals and information about services, but the one thing we can't necessarily do is always get an aide in there. We have 3 home care agencies that we work with in the county, but they don't have the aides. We have some areas in towns where there's no aides. So that's something that really needs to be looked at very carefully, and I know it is something home care agencies are looking at, something our office is looking at, as well as your local, state, and federal governments. Pushing for increases in wages, increases in cars that they could use to travel from client to client's house, and or increased mileage rates, paid trainings, things like that. So that's something we're working on because we are very worried about what's going to happen if there aren't the aides. We all want to stay at home. We all want to age in place if we can, but that's not going to be possible unless we have more people doing this very hard, very rewarding, valuable work, but it is a hard job.
It is a hard job, and the money is there right now in terms of, it's not something that you can earn a living wage at for the most part, is it?
No, it's not. And not when they can look at, one of the other, retail stores where they could make a couple more dollars an hour and go do that instead. And I think you have a lot of people.
And you'd go to one workplace instead of having to travel to several places.
Traveling throughout the county. Yeah, you might be traveling, 50 to 100 miles in a day. And so I can see the appeal of that. I think you do have a lot of interest. There's a lot of individuals who are LPNs who might be interested in this type of work, but until the wages are increased, you're not going to get them.
Right. And I'm going to assume here, and you can tell me if I'm wrong, but that some of the communities where you don't have as many helpers as you need are some of the more rural, isolated communities.
Yes.
So if you're in a Canton, a Potsdam, a Gouverneur, Messina, and Ogdensburg, there's a lot more help available. But you get out in the hinterlands and
absolutely, like Brazier, Star Lake, those types of areas, it's very limited.
And that's also where you're going to have the transportation distances to get somebody to them, aren't you?
Yeah, it could be 15, 30 miles in between houses.
Right. So one of the things that we know in the senior population is that they also have specific health care needs. And I think one of the things that people will find surprising is there's not a single health care provider who is a specialist in gerontology in this county. So we're really looking at a lot of the primary care providers who are doing this kind of work, but maybe don't have the specific information they need to actually help the senior population quite as well as they could.
Sure, absolutely. Yeah, they receive training in medical school, and certainly for doctors around here, I would say a bulk of their clientele are seniors, so they're getting on the job experience versus necessarily specializing it in medical school.
Right, but that doesn't change the needs. For example, if someone goes into the hospital and then comes home, they're going to need help at home. And although, as you said, there are 3 healthcare agencies that provide that kind of help, a lot of times a senior's coming home and either has no one at home with them who can give that assistance, or the person isn't that well themselves if they have a spouse because of aging and health care issues of their own.
Sure. Yeah,
so a lot of these issues are kind of chronic conditions that there is no quick and simple solution to, is there?
It's a long-term illness. It's going to take its course and take its time.
Yeah, that's right. The other thing that we know is that fewer than half of Americans who are over age 65 are up to date with their prevention care stuff. So that just speaks volumes right there about how we have put off and put off and put off things that will actually prevent the kind of health problems we've been talking about from showing up in the first place. Once a senior hits 65, of course, they're eligible for Medicare, but navigating Medicare is pretty darn confusing, isn't it?
Very much so. Very complicated.
And you actually have someone in your office who can help seniors do that. I know when my husband turned 65, we turned to Nancy because we knew it was going to be a lot easier to have someone hold our hand through the process. So talk to us a little bit about how your office can assist seniors in getting through that initial phase of getting on Medicare.
Sure. We have a trained, certified healthcare counselor, Medicare counselor, who can walk through all the options with somebody and really help demystify what is a very scary and confusing process. Personally, I feel there's way too many options for folks. It's too confusing. It needs to be much more simple. When you talk about your advantage plans or your supplement plans, what should I get? Or what about a drug plan? It really is quite complex. The one thing I do tell people and I have to stress is that it's one counselor for 22,000 seniors in St. Lawrence County too. So we also work in partnership with the New York State Office for the Aging, where anybody that we can't see, we refer to them, and they will refer that person out to another certified healthcare counselor in another county. So they're still receiving that same quality level of service, but it's not just necessarily in our county in person. And that's a frustration, is that, that's right down to funding again. We don't receive even enough funding to pay for one staff member from the state or federal government.
Clearly with 22,000 people, you could use more staff
Oh,
members.
we can have 5 full-time Medicare counselors easily, and they would stay busy every single day.
Right, and we should also point out to people who are on Medicare that right now is that open window for changing your plan. For example, maybe your health has changed, maybe you're on a different set of long-term drugs, and you really need to be looking at whether or not you need to switch out one of those very confusing plans for another one that will actually better meet your financial requirements.
Yeah, October 15th through December 7th is Medicare open enrollment, and that's when, if anybody's unhappy with something, their premiums have gone up dramatically, if they can't afford their plan, that's when they need to call and get some guidance about next steps and switching their plans.
Good, good. Well, that will be good. Well, one of the things we wanted to talk about today specifically with you is about aging in place, which is because we know how expensive nursing home care is and how few really true assisted living spaces there are in St. Lawrence County. Big county, very limited number of those kinds of spaces. So aging in place is really not only in many cases the best option, it's the only option people have, but their housing may not be very senior friendly because we have a lot of older housing stock in this county that was not designed for the kind of handicap access that you may need as you age. So let's talk a little bit about that. What are some of the key considerations for folks?
Sure, really making sure they have accessible bathrooms, looking at their tub, trying to get maybe a walk-in tub and or a shower if they've always used a tub, that step up, safety rails, those types of things. If it's somebody with dementia-related issues, they're a family member, if they have someone providing, it's going to want to look at, really making sure locks are maybe higher up where the person can't reach if they're eloping at night, things like that. Lift chairs, those types of things. If they can move a bedroom down to the first floor so that the senior doesn't have to do stairs any longer, those types of things are all really important.
Yeah, and one of the things we know that for a lot of older houses, when a bathroom was put in, back if the house is old enough to predate indoor plumbing, it was put up on the second floor, which really, and there might be a half bath downstairs, but that's not going to meet the needs of someone who has mobility issues on stairs. And it isn't always easy to create a bedroom on the first floor if all of the bedroom space was designed for the second floor of the house. So these are long-term, sometimes modifications, and if you come home from the hospital and need a downstairs full bath and a downstairs bedroom, you can't make that happen in a couple of days' time.
No, pre-planning is key. Really thinking about things before people get sick, whether it's home modifications, whether it's your financial plans, your medical plans, really having those conversations before crisis hits. Because when the crisis hits, you're in the hospital, you're sick, you're not as rational thinking. It's a highly emotionally charged situation. So we encourage as much as possible calling our office even before there is a problem, finding out what services are available so that when you are in that situation, where you or your loved one, you're sick, you can have that information already at your fingertips and be able to make the best plans. So thinking about it, when you first retire, even thinking about, okay, what kind of home modifications would I need if something happens or my mobility is threatened?
And sometimes it's a case not even of the person or the person's spouse. You may actually end up taking in an elderly relative or someone who has severe medical issues who can't stay alone anymore. So you need to get your house set, not for you quite yet, but maybe for someone else in the family. So that's a great opportunity to start thinking long range and making those kinds of choices. Sometimes it's as simple as changing doorknobs. Instead of round knobs, you use the lever handle so that someone can get in and out of a door safely. And making sure that, for example, when the hot water comes on, that it isn't so hot that someone's going to get burned if they can't get the hot water turned off when they're in the shower. So there's lots of small ways that they can make modifications, isn't there? One of the things that I was very fascinated to read about, and the first time you came in, you had just started your Office of the Aging Facebook page. And so
Yes.
I signed up for that, and I'm constantly reading on that page. You're sharing information and articles that are so interesting. And one of the ones that you recently did was about what the elder orphans are and how many
Yeah.
of them are coming. So let's talk a little bit about the elder orphan problem, because that certainly is something that we're going to be dealing with in this county as well as everywhere else.
Sure, that's a call we receive daily from folks who they don't have anybody. They're either, they've outlived family members, and or their kids have moved out of state, and they're really alone, and they don't have that family caregiver that can take care of them and check in on them. So what do they do, particularly when there's lack of resources and those types of things? So, yeah, it's a growing epidemic, I believe, much more than is talked about.
Right, and and again, that's the sort of thing that if you are thinking about that ahead of time, you can start to explore what some of the options might be. And it might be a case of finding that home health aide or someone like that who can come in on a regular basis. And whether you are self-pay or whether it's a case of after the hospital, that's part of what your insurance would pay for, but you still need to know what those resources are.
Well, and I think the key there too is making community connections.
Yeah.
For those people who aren't going to be able to rely on a family member for whatever reason, a lot of times they're going to faith-based organizations or community organizations, and they become the caregivers. And we see that time and time again. So we really encourage folks to get involved while they're able to in their community, because it's those organizations that will come in and really help fill that gap.
Right, and that's one of the things that we're very rich in is community organizations here in St. Lawrence County. Every small town has a faith community. Many of them have a place to go, for example, a neighborhood center or something like that that the CDP makes available to them. So they really do have probably more resources than they thought about, just because they haven't had to tap them today.
Right.
But it's the pre-planning that is really the key, isn't it? So let's talk a little bit about the kinds of services that the Office of the Aging offers to folks on a routine basis that would help someone to stay at home. For example, and my own family is now using Meals on Wheels, which is a godsend, because especially for older folks who either are having trouble getting out to shop or just don't want to cook for one person. You know, that's a real problem.
It is.
And nutrition is one of the things that we know leads to good health. So if you keep your nutrition up, you're going to have fewer health problems. So let's talk a little bit about how Meals on Wheels works and how people can access it, Andrea.
Sure. Anybody who's interested just needs to call our office. And then we have an assessment that's done. So a staff member comes out and does an assessment on the individual, because it's not just finding out if you need the home delivered meals. A lot of times that's the first phone call someone will make to our office, but it really opens up the door to the other programs and services that we offer, because when we're there we can say, well, have you ever thought about this? Home care, well, it seems like you might need some home care. Can we help you with that? So they call the office and we need to find out where they live, and if we have a route in that area. We have 13 different home delivered meal routes. 33 going out. See, I'm losing track of how many. I was like, wait, we have 6 in one site. So we have 33 routes going out throughout the county, and seeing if we can fit that person in. A lot of times, even if we aren't able to deliver to the person's house, we can make an arrangement that a family caregiver or someone else or the client themselves could once a week pick up meals, 1 hot, 4 frozen. We have clients who meet or their family member meets someone out on the route. So we might not go over within 5 miles of the client's house, but someone can come and meet them and get that meal still for that person. So we try to make whatever accommodation we can to get people fed.
And that, in a county like St. Lawrence, which is geographically so large and the communities are so dispersed, and even people live off on way back roads. So the fact that you figured out how to make this happen is really a testament to understanding what the need is and then figuring out how to meet that need, regardless of how many hoops we have to jump through to make it happen, right?
Exactly.
And so talk a little bit about there's no cost for this program at all. If people need it, they don't have to. It's not like you going to a restaurant. You will not get a you won't get a bill when you go pick up your meal, so.
No, there's a suggested donation of $3 per meal, and it really is suggested. It's for people who are above the federal poverty guidelines. Now, no one is ever charged. If there's an inability to pay, they get the meals. And we don't, again, there's not a bill per se. We keep it very delicate for folks, very respectful, understanding that folks need, if they can donate, great, and if they can't, that's okay, still come in and have a meal. We want to make sure people are fed, and that is our main goal.
And you just opened up a new meal site.
Yes.
So let's talk a little bit, you don't just necessarily get the meals delivered to your home, you can actually go to a meal site which allows for socialization and other things, which is so critical for the elder population who may not have as much in the way of support networks as they used to have when they were out in the workforce.
Right, yeah, congregate dining really is important. Home delivered meals are very critically important for our very ill folks, or for those who can't get out. But we really stress the importance of congregate dining for its food, friendship, companionship. It's getting them out for more than, as you said, more than just a meal. It's a reason to get up in the morning, you have somewhere to go, you have something to do, and you're going to meet a friendly group of people. People often stay after and they're playing cards, they're games, those types of things, or even just sitting around drinking coffee and chatting for a while. We have a new one that we just opened in Governor, and that's going really well at the Governor Community Center, which is conveniently located just past the hospital and right next to Pine Grove Apartments, which is a senior housing complex. So it's a really ideal location.
That's great. And how many sites like that do you have around the county? What communities are served? Okay, so.
We have 8 throughout the county.
Okay,
yeah.
that's great. There's some other things that you also provide, like you have home health aides that you can actually dispatch from the Office of the Aging, in addition to the ones that are from the other caregiving agencies. So.
Well, we actually only contract out.
Oh, you contract out.
We don't have any internally.
Okay. And what about transportation services? Because for a lot of elderly people, they've given up their car, or they are savvy enough not to go out when they shouldn't because the roads are bad, or their conditions are poor.
Sure. We contract through Volunteer Transportation Center, which is a wonderful organization that offers medical transportation to individuals with who don't have a vehicle. They will take in county, out of county. They will go to Cleveland Clinic. They will go to Syracuse, Burlington. They'll take the client wherever that they need to go. They also offer unlimited cancer and dialysis treatments. So it's 5 in or out of county visits per month, but cancer or dialysis treatments are unlimited, which is great. They'll do 1 grocery shopping trip a month, which is important because a lot of seniors are shopping at their local store, and it's not the most cost effective. They want to go to a major grocery store.
We know that for lots of the smaller communities in St. Lawrence County, they are what's called food deserts, and you're really shopping at your gas station, which is not, you're not going to get fresh fruits, you're not going to get fresh vegetables, you're not going to have choices of a lot of things there. It'll be just the basics and the staples, and the price is not as competitive as it is when you can go to a community that has 2 or 3 grocery stores.
Exactly.
They don't have sales at the gas station,
they
unfortunately. So, and a couple of other things that I think the Office of the Aging does a really great job at, and maybe people don't really understand that, is the classes and instructions that you do. You teach people how to use social media and how to use computers and things like that. And for lots of services now, the only way to get them is by the internet, isn't it? So for an older population that hasn't grown up with them like our young folks have, this is a real deficit.
Absolutely, yeah, and we stress a lot on that. We have a Walk with Ease class that we offer through the Arthritis Foundation, as well as Tai Chi for arthritis, which is one of our most popular. And they're really low impact. Anybody can do them. Walk with Ease and Tai Chi can both be done from seated positions, the exercises, so mobility isn't necessarily an issue. We even had a woman with visual impairment take our class and was able to complete it successfully, as well as the computer classes. We're offering more and more tablets and smartphones. We're getting a lot of seniors really requesting that. They want to learn some internet basics and those types of things, but Christmas time especially, their kids are getting them, or grandkids are getting them tablets and smartphones, and not necessarily showing them how to use it.
Right.
And that's the biggest thing, is getting it turned on and showing them, demystifying the
Right.
internet for them so that they can feel comfortable and also not get taken advantage of either, because that's something to
Yeah.
worry about.
That's true. There's a lot of people who prey on senior citizens as well, and so they're the targets of a lot of scams and things like that. And of course, if you're a mobile senior citizen, you can always come to places like the public libraries who will do
Yes.
those. But for a lot of folks, I think they feel better learning in their own age group because they know they're a little behind the curve maybe, and so it's a little less intimidating if it's a room full of people who are their peers, who are
Sure.
all kind of struggling at the same time.
They don't have to be insecure about it.
Right, and so Andrea, talk a little bit about how, because one of the things, as we talked about earlier, is we have a whole group of people who are retiring, a new stream of, these are early retirees, their health is probably still pretty good. They have these kinds of skills that they've developed through their work life, and they make great volunteers for your programs, wouldn't
Yes,
they?
absolutely. We are always looking for volunteers, whether it be in the office or for nutrition, delivering home delivered meal routes, working in the kitchens. We get a lot of volunteers through that. The biggest thing that we could use help with, and some of our recent retirees would be perfect, would be they could become certified Medicare counselors. And that's something we would pay for the training through our office, and then they could help seniors during open enrollment do the Medicare counseling.
What kind of training is involved? What's the time commitment for the training? I mean, in terms
Sure.
of that, because there might be folks listening who say, "Hey, I could do that.
Sure.
I'd love it."
It's a day training.
Oh, okay.
That we would send the person to, as well as there's an online class component. And certainly the biggest thing would be learning on the job, shadowing our Medicare counselor, and just watching a few enrollments through her and seeing the ins and outs of it. And then they'd be up and running and ready to go. Time commitment really is based on the person. We can say you could work 2 hours a week, you could work 10, 15. It really just depends on what they're interested in and what their schedule allows.
And the truth is that it isn't just during the open enrollment period that you need it, because seniors are turning 65 all throughout the year.
Yes,
So
year-round.
for first-time Medicare enrollees, they might need that help sometime other than in the fall when the open enrollment period is. So,
Yeah, year-round we could use this help, absolutely.
and if somebody goes away to Florida for the winter or someplace warm, then they can come back in the spring and help out. So
Sure.
it's on a the amount of time you have to donate is what you donate, but you would help with the training. So I think that's a great opportunity for
Yeah,
folks.
I really do.
Andrea, thinking about helping people now, either through your office in general, what do you think the greatest need is, and how people, particularly people who want to volunteer, can be most effective to making a difference in the county for seniors who need help? What's probably the biggest thing in your mind that people could make a big difference in?
Sure, I think, donations always help to increase, we were talking about funding levels remaining stagnant. And we do have some very generous people who are regularly donating to us. So I think that would be a huge help if, more people would think, especially at the end of the year, thinking about where their contributions to go, knowing that you're helping seniors in your own community by providing them meals and services that we haven't received increases in funds. We rely heavily on donations, and I don't know that folks really realize that as much as we do. As well as if people were interested in, we have a whole group of people that started a home delivered meal route in the Parrishville area because they saw the need in their community, and so now we have a run 5 days a week that is run entirely by volunteers. So if there's groups that would be interested in that type of thing, they should really contact our office and we can discuss next steps.
And then they can, if they see a need in their community, they can help to fill it by working through existing services that you already have.
Absolutely.
And you also have a holiday promotion coming up,
Yes,
don't you? So let's
we
talk
do.
a little bit about that, since the holidays will be just around the corner.
Just around the corner. So we started my first year with the organization where we started a holiday basket drive for seniors. We realized holidays can be very lonely for seniors, especially our rural, isolated ones on our home delivered meal routes. Many of them don't have, as was discussed, current family members or friends still around. So what we did is we collect donations of new unopened items, and we make these holiday gift baskets that we give them in mid-December. We put everyone's name in a hat and pull out. We started small, 20-some the first year, and last year we were over 80 baskets.
Wow.
So it's growing and growing every year, and that's thanks to the generous community support that we receive. A lot of our senior clubs donate, which is so nice. We're hoping for about 100 this year, and I have to say it's our favorite time all year.
Oh, yeah.
We cry, the clients cry, and so many of them, you can't remember the last time they received a Christmas present, and that right there makes it all worth it.
That tells you something, doesn't
It
it?
does.
About how people are really feeling isolated
Yes.
in their homes. And as much as we've talked about how important it is to be able to age in place safely, we don't want them to be aging in place lonely.
No, and all alone, absolutely not.
Well, Andrea, thank you for coming in. This has been a great conversation. I'm hoping that the donations, especially for your holiday program, will increase and that
That'd
you
be
can
great.
hit that 100 basket mark. That would be
Fingers
great. So thank you so much.
Thank you.
These conversations are a production of North Country Matters, which is filmed here in the Fred W. Cleveland Computer Center of the Potsdam Public Library. These conversations are a civic collaboration between the American Association of University Women of St. Lawrence County, the League of Women Voters of St. Lawrence County, and the Potsdam Public Library. Until next time, remember, our North Country matters. Thank you so much. This is such a
Thank
great
you.
conversation.